Hey everybody, how you doing? And welcome to Strategic Prevention Framework, and where you can learn all of the 7 steps through the various video tutorials that we have for you. So we're going to be kicking it off with assessment today. But before we get started, go ahead and grab a pen, some paper, and get ready to take notes if that's something that you like to do. If not, use your computer. You can also use your cell phone if you'd like to. That's all good with me. Also, if you got an iWatch or an iPad, go ahead and power that thing up and get ready to take some notes if that's something that you like to do. So we're gonna get started here soon, but again, we're gonna be starting off with assessment. So before we do, let me ask you this question. If you're ready, let me hear you clap once. Oh yeah. And if you're really ready, let me hear you clap twice. All right, here we go. We're going into assessment. So why do we do community assessment? Community assessment is important because we want to create a community consensus. We want to create consensus around what are the issues that are happening within our community. We want to look at the data that shows us some of the issues that are going on. Don't get me wrong, we don't always want to look at just the negative things. We do want to pay attention to the positive things that are occurring also, and that is a part of the assessment. And the way that we kind of do that is by gathering a lot of different facts and information and looking at different things that I will go into later on in this presentation so you can see what those are. But the other thing that you need to remember is that we are looking at things from an ATOD standpoint. We are looking at information that is regarding alcohol, tobacco, and other drugs. And so that's what we want to focus on in helping us to determine what our issues are in our community and then discuss how we can impact those in a positive way to decrease ATOD. So when we do community assessment, we want to identify and analyze underlying factors. We're trying to get a really good idea of what is going on in the community. So in order to do that, we need to identify and analyze the underlying factors. So you're asking yourself, well, Jamal, what are those underlying factors that we need to look at? Bang, there it is right there. There are 3 things that we're actually looking at when we're looking at underlying factors. We're looking at the environmental, we're looking at the social, and we're looking at the individual themselves. Environmentally, when we're talking about this, we're talking about the environment in which the ATOD is occurring. You might want to look at things like lighting in certain areas of where people might be uh, conducting drug deals. We may be looking at how many liquor outlets there are within a particular area. We might be looking at what's happening in a particular environment where youth can actually get their hands on things. So we're looking at the environment and trying to identify what's happening there. The second thing that we want to look at is the social aspect of it. How are these drugs being misused or abused within social contexts? Is it like during happy hours? And the bartenders are over serving people because they have penny beer night or something like that. So we also want to look at these kickbacks that youth call them and have. So they're just socially hanging out or maybe gaming and just doing their thing on Xbox or whatever, and they passing around joints and whatnot. So socially, what's going on there for them, and why are they using that as an opportunity to misuse or abuse substances? In that type of gathering. And then individually, there's some things sometimes going on for individuals, right? We know that there's trauma informed care right now, and then there's trauma informed prevention. And so, what kind of trauma maybe has occurred in one's life where it's impacting them to be using? Is there a cohort of people that have similar, these individuals coming together and have a similarity as far as why they may be using? So we want to look at the individual, we want to look at the social, and we want to look at the environment. So again, Doing community assessment means selecting and implementing. So we want to select and implement things that we know will have an impact on what it is that we're trying to deal with, and that's alcohol, tobacco, and other drugs. The other thing that we want to do is we want to establish a baseline that we all agree upon as far as what is it that we're dealing with? What drugs are we dealing with? How much of it are we trying to reduce as far as alcohol, tobacco, and other drugs? Maybe marijuana or prescription medication or cocaine or meth and things of that nature. So we want to establish a baseline so we can see if we're actually having an impact on those particular substances that we look at as a community. So, in order to do that, we have to create and maintain coalitions and partnerships. As you all know, it's really important for us to work together with various people in order to solve such a huge problem. So, the question is, why develop a coalition? We develop a coalition because there's an old saying that says, um, two heads are better than one. And in this case, having multiple partners is definitely better than having just one organization or two people. So the more people that we can come together or bring together and help deal with this situation is extremely, extremely important. So when we take a look at who do we need, DFC, which is drug free communities, requires that we have 12 sectors. 12 sectors means like 12 partners or entities or businesses and things of that nature. So they say that we need 12 sectors. And so when we look at that, who is that? So our 12 that they say that we need to have as a part of our coalition, hey, lo and behold, look at that. Number one, yes, we need youth involved. We need persons under the age or equal to 18 years of age. We need youth. Youth are so, so important to the success of our coalition. Without them, we would be nothing. We believe that youth hold a lot of the answers, especially when we're trying to reduce substance use and misuse amongst the youth. It's important that we hear their voice. It's important that we get their input. It's important that we understand their perspective. It's important. It's highly, highly important. And so, without youth being a part of our coalition, there's no way we can be successful. We also need parents. We need business community. We need the media. We need schools, which is awesome because we have a great relationship with our schools in our area, which is primarily Sunnyside Unified School District. Love them to pieces. They're extremely helpful. We need a youth serving organization. That's an organization that helps youth. So a good example would probably be Higher Ground, if you know of them. That's a youth serving organization. Actually, Child and Family Resources also is a youth serving organization because of the department that I'm a part of. We need law enforcement. Love them to death. Man, TPD has been doing a great job in Sunnyside area and been extremely helpful and supportive and there for us and willing to do anything that they can to help us out. There are some other ones that we have to include, right? Because we said we needed 12 sectors. The other one is religious or fraternal organization. So that means we need to get the faith-based community involved also. We know that we have a lot of great churches within our community and a lot of different denominations of churches, if you will. And what I mean by denominations are, you have Catholic, you have Baptist, you have a few of the other Southern Baptist and non-denominational and things of that nature. Then we also need civic and volunteer groups. An example of that would be like the neighborhood associations that are within our neighborhood. We have like SNAP. We have we have the Barrio Nopal. We have a bunch of other ones also. So Sunnyside Neighborhood Association, and we actually have some of those leaders that are a part of our coalition currently, which is phenomenal. We need healthcare professionals, people that are in the healthcare business and know kind of what's happening when it comes to substances. Like Pima County Health Department is an awesome one. There's La Frontera and COPE and Kodak. Those are people that participate at those particular agencies would be great to have on board. We need state, local, or tribal agencies with expertise in the field of substance abuse. Again, that could be Pima County Health Department. Also with that, we do have City Councilman Richard Fimbres, who's a part and supports our coalition. and then also other organizations involved in reducing substance abuse. So those are the 12 that we look at when it comes to helping the coalition and knowing that we need to have those partnerships so that we can maintain our coalition. So, as we continue to move on, one of the things that we have to do is we have to define our community. We have to define our community. And what that means in defining the community is taking a look at the geographical area in which we want to work. And the area that LPKNC works in is primarily the South Side. And when we say South Side as LPKNC, we mean from 22nd Street and south. And our most western boundary, if you will, is primarily I-19. We do go a little bit outside of that, but we try not to go into the Midville area. We sometimes skip over them and help our brothers and sisters a little bit further out by the casino and things of that nature if they request our support. So that's our most western boundary, technically. And then if we look at our most southern boundary, it gets a little tricky. It's kind of like how would you say our southern boundary? I mean, I like to say Los Reales, if you will, but it's not a street that goes all the way straight across because it bends and curves and all that stuff. But Los Reales, and then our easternmost boundary primarily is I-10 again over there. Because we take a look at the Little Town area when we look at Craycroft Elementary and we take a look at Lawford Middle School. So again, we primarily look at the Sunnyside Unified School District boundaries and use those. Again, it's not a clear cut boundary, just because of the way the roads are constructed and go and bend and curve and things of that nature. But so that's the way we kind of define our community. The other thing that we need to take a look at when we're talking about defining our community, it's we need to understand the history of our community. Our community has a great history, and we need to hear the stories of our community. And that's why it's so important to make sure that we have some of the most incredible people from the community who are leaders themselves, a part of the coalition, so that they can remind us of some of the issues that have been going on historically in the community. Because if we don't take into consideration the history that is there, we could possibly do more damage than good. And what I mean by that is we could end up opening up some old wounds. We need to be sensitive to issues that have that pertain to our community. So let's be a little bit more specific about what we're looking at when it comes to community assessment. So let's break that down a little bit. What needs to be in our assessment for us to really take a look at our community? And so we want to take a look at demographic data. We want to take a look at demographic data. So what might that include? So we want to take a look at within our area, the total population. And the total population and how we get there, basically, and a lot of the things that I'm going to show you on this slide, we use the census data. And it's something that there'll be an attachment for you to be able to look at to see some of that data. But we want to take a look, and the way that we do that also is looking at our demographic data is we use zip codes to help us break down our particular area. So within the LPKNC area, there's various zip codes that we have that we look at when we try to pull up data and things of that nature. So, but what we want to do is look at the total population, which according to the last data I looked at, there's about 150,000 people within our area that we know of according to the census data. Of course, there's going to be new data coming out, I believe, in 2020. So we'll take a look at that then. But then we also want to take a look at gender. Gender is male or females. How many males do we have? How many females do we have within that 150,000, again, approximately population? And then also we want to take the racial ethnic breakdown of that group. We want to see how many Hispanic, Latinos, African American, Asian, Anglos or / Caucasians. So we want to take a look at that so we can have an idea of what we have within our community. And then we also want to look at the age groups. That's important to us. Uh, how many young people do we have? 0 to 5, and then 6 to 10, and then 11 to 18. And then, how many senior citizens do we have? That's important. So we just get an idea of who we're dealing with within our community. Then the other things that we want to take a look at, we want to look at educational level. We want to take a look and see what the average educational level is. And the reason that we want to do that is because that's going to help us determine to what level should we be writing information. If our average age education level is, fifth grade, then we want to make sure that we're sending out information so that somebody that has a reading level or educational attainment of a fifth grader or a sixth grader or eighth grader or a 12th grader write things in such a manner that they can be able to grasp what we're trying to put out there to help reduce substance use and misuse within our community. We also want to take a look at the primary language, right? I mean, the primary language, just telling you right now without you looking at the data itself, is primarily English. But we do have a secondary language, which is Spanish. And that's really important to us because that means we need to make sure that we're sending out information in both languages, or creating messages that are in both languages so that we can impact them. If we were to leave out English speakers or Spanish speakers, then we would not be able to really impact or get information or messages out there to people that are primarily within our boundaries. And then we also look at average household income. Again, that's going to let us know basically just the amount of money people have in their pockets, and then that could translate into how many young people have disposable income. Disposable income is money, meaning money in their pockets. I know for a fact that, like on the north side, if you will, north and northeast and central and things of that nature, their average household income is a lot larger than ours within our area, and it tends to show that those youth, have a little bit more money in their pocket of disposable income, so they're walking around and able to maybe have $20, $50 in their pocket. And so what does that mean? That increases the likelihood that they could probably get their hands on additional substances because they just have that spending cash on them. And then we also want to look at the size of family households. Is the average 2 people per home, or is it 4? And the reason that this is helpful to us is because it lets us know that while we may focus in on youth from middle school and high school, that they have siblings that are impacted by what they do. And then we look at the poverty data also, just to see how many people or households fall within the poverty range. And again, that just gives us an idea of a bit better picture of like what's going on in our community. So when we talk about assessing the community, there's something else that we want to take a look at. We want to take a look at core indicators. Now, these core indicators are prescribed by DFC, aka drug-free communities, in helping us to understand the issue of substance use and misuse within our community. And all DFC recipients have to deal with these core indicators. And so let's walk through them a little bit. We want to take a look at the average age of onset of any drug use. The average age of onset of any drug use. So you might be asking yourself, well, what does our average age of onset mean? Primarily what that means is that at what age do people begin to use a particular substance? So at what age do people begin to use alcohol? At what age do people begin to use marijuana? At what age do people begin to use prescription drugs or opioids or cocaine or meth? So that's what average age of onset means, the beginning of use. And then we also want to take a look at, and this is primarily, these core indicators are from youth. So we're talking, these core indicators are regarding the youth within our community. So for youth in our community, what is the past 30-day use? What substances have they used within the past 30 days? This gives us an indication and helps us understand what substances are pretty prevalent or being used a little bit more frequently and regularly within our community, and can help us really understand um, the different things that or substances, excuse me, that people are using. Then we also want to take a look at the perception of risk or harm. We want to take a look at the perception of risk or harm. And what that means is the perception of risk or harm is how harmful do you believe a substance is? So, do you perceive or believe that alcohol is good or bad for you? Do you believe that marijuana is good or bad for you? Do you believe that prescription drug use or you using prescription drugs is bad for you or good? Do you believe that cocaine or methamphetamines are good or bad for you? So we want to know what people's perception is, even if they're not using it themselves. Do you believe it to be bad though? Because there's research that shows that if people perceive that marijuana is not harmful, then they are more likely to use it. And a really great example of this is with tobacco, right? If you think about tobacco nowadays, everybody, especially young people, when we're doing in classes and sharing about tobacco, I mean, most youth are like, "Oh my God, that's crazy, that's dumb. What are you using tobacco for, or whatever?" And that's because of all the information, data, programming that has been given to young people ever since they were in elementary school. And tobacco prevention has done an outstanding job of pushing those messages out there. And so, one of the things that we want to do is kind of replicate that in some degree is when it comes to alcohol, marijuana, prescription drugs, cocaine, methamphetamines, and things of that nature. So, and then there are some other things that we need to do, right? In order to get this information, what do we need to do? Not only do we need to gather that data of the points that I just mentioned before, but we also need to maybe collect secondary data. So you might be saying, well, what's secondary data? Well, let me tell you. Secondary data are things like where we look at uh, police police logs and data and information that they have. And actually, you can find a lot of it on their website. Um, they have a portal where you can pull up arrest datas and also find out what type of arrests occurred for car theft or minors in possession, or I mean, it's just anything. I mean, they got a whole slew of um, different, how do you say it? Just different arrest categories, if you will. It's pretty interesting when you go in there and take a look at it. Um, you can also find about DUIs. So that's some different type of data that you want to collect to help build a picture around what's happening around substances. The other thing that we want to take a look at is maybe saying, hey, how many beer runs are happening at the Circle K's and the Quick Trips? That's secondary data that can help us paint a better picture of maybe where things are occurring, or we can then ask the question, well, how is it occurring, and in what areas, and things of that nature. And another secondary data point that we may take a look at is students being suspended from school for substance use and misuse. Are students being suspended because and or expelled from school because of using vape pens or using these jewels with their little things that look like USB drives or thumb drives or flash drives, and you can put cartridges in them and smoke. I mean, so how many students are being suspended because of that, or having negative consequences because they're involved in that? So all this data, arrests, DUIs, beer runs, students suspended from school, um, and other things, this helps paint a better picture for us and how we might combat the issue. So my question to you is, can you think of other type of data that we could be looking at to help paint a better picture? Take a moment to think about that and share with the group. So as we continue on, We need to consider data collection methods. Data collection methods. So, what that means is, how do we collect this type of data? There are different ways that we can get data, and I'm going to share some of them with you right now. One of the ways we can do that is through surveys. And so, how we do currently use surveys, it's called the Arizona Youth Survey. It's a survey that's given actually throughout the state of Arizona. And um, parents have to give consent to for their youth to actually take this survey. And not all school districts do it, but our partner, Sunnyside Unified School District, does do this survey. Um, TUSD, a lot of the schools do it. Flowing Wells, Amphi, um, and I think it's Sabino, they also do it. So I don't know if Sabino's a school district or not. So excuse me, but anyway, there are a lot of different districts do it, and again, it just gives us good information from the youth themselves as far as what's happening within our community. The other thing that we look at is mapping. So, what is mapping? Mapping really is about taking a look at where are things happening, where are the parks and recs, where are the churches, where are the CVSs and the Walgreens and the convenience stores that serve alcohol. Um, where are the schools located? Where are um, the, I mean, just a lot of different things. I mean, that we could come up. I mean, we really want to take a look at where things are within our community, so that we have a better picture of where things are. Because when we talk about businesses and things of that nature. So the other thing that we can do is key informant interviews. So key informant interviews are really about taking a look at and finding people who are dealing with substance issues and interviewing them about how it impacts them. So when we talk about businesses, we can interview business folks to find out, hey, what's going on for you? You know, um, are is it hard for you to find people to work for you because they can't pass a drug test? I remember talking to a landscaping guy who said that he's drug testing all of his people now, and he said he finds it difficult to find people who aren't abusing substances, and so that's huge for him because he can't find qualified workers um, because of drug testing. And why is that important? Why is he drug testing them? You may ask, and you may know, but it's because I mean these people are going into people's yards and homes, and you don't want them necessarily breaking into those homes um, to score money or goods in order to pay for their habits, because then that looks poorly upon that business. Also, the other thing is too, if you think about I don't know, Dollar General or Food City or Fry's or anything like that. People don't necessarily want to hire people um, that are addicted to substances, because they then don't know if they'll be timely in coming to work, or are they going to be having people come in to sell them things that they shouldn't be selling them. And so we want to have interviews with these key people in our community. It's not only businesses, it's leaders from neighborhood associations, it's city council members, it's anybody that has some information that can help us paint the picture so we can actually make an informed make informed decisions on how to deal with the issue. The other thing that we can do is we can take a look at focus groups. Focus groups are highly, highly important, because what you can do is bring together a group of people and ask them similar questions and kind of drill down on a particular issue. So we could bring together parents to find out what they feel is going on, and you have a set of questions that are already predetermined, and you ask these groups these questions and see what their input is. And again, it just helps paint that picture. So it could be focus group, can be a group of parents, can be groups of youth, it could be a group of senior citizens. It can be just maybe a group of monolingual Spanish speakers. Could be people who are stay-at-home moms. It could be people that are part of the landscaping community. It could be people that are part of churches. So, focus groups are bringing groups of people together. Those groups aren't really too large normally. You normally want about, 7 to 10 tops, um, to get an idea of uh, where that group is coming from and what information do they have to, again, make paint a picture so we can make informed decisions. The other thing that we want to do is look at observational data when we're collecting it. Observational data is like going out and driving around and saying, okay, how many alcohol outlets, alcohol places that serve alcohol or sell alcohol, where are they located? How close in proximity are they to each other? Meaning, how close are they to each other? How far are they away from schools? The other thing we can look at as far as observational data is we could take a look at, go around and count how many billboards are there that are advertising alcohol or marijuana dispensaries, or how many of these places that serve alcohol have banners or advertisements up that uh, you know that might be en route where kids pass by that place all the time and see those advertisements and messaging around alcohol, or now it can even be marijuana, right? Or it could be prescription drugs. Um, and so observational meaning going out and really counting and taking a look at different things to see what's going on. So the other thing that we want to take a look at is collecting environmental data. Environmental data, kind of, I touched upon it already, is but the alcohol outlets. The other thing that we want to take a look is where are youth getting their alcohol from, or their drugs in general. I don't want to pick on alcohol because, I mean, there's so many substances that we can look at and deal with. But where might they be getting their cocaine? Where are they getting their marijuana from? Are they getting it from somebody that's actually 18 and older, or maybe 21 and older? Somebody that has a medical marijuana card already? Those are things and questions that we want to ask, and that's also finding out about the environment. And are they getting it in parks on the corner? Are they, uh, you know, I don't know. It could be anywhere, right? So I mean, those are the questions that we want to take a look at and ask through those different means that we just discussed to, again, help paint a better picture of what's going on in our community so that we can make informed decisions. So the other thing that we want to take a look at that's really, really important is that we need to recognize and understand that every community already has some resources within it. What I like to add here is not only about resources, but this is also about the positive things that are going on in the community. So those all can equate to resources, um, but I like to also think about it just from positive you know, aspects. How many parks and recs do we have within the community? How many parks do we have where people can do alternative activities as far as running, biking, skating, basketball, soccer, baseball, softball, things of that nature? So, are those resources within our community? Um, we also want to take a look at what other existing prevention initiatives are already happening in our community. What about treatment services? Are there La Frentetas, Copes, and Kodaks, and um, others within our community that are already offering services? What local businesses do we have, and what do they offer um, as far as you know contributing to our community? Um, and we know that there's a bunch of them. Are they predominantly restaurants? Are they predominantly uh, machinery places? Are they predominantly fast food? Are they predominantly, whatever it is? We just want to get an idea of what's there, because we might find that maybe we're missing some type of businesses that can be um, a resource to helping us prevent the use and misuse of substances. We also want to take a look at, again, as a resource, somebody that can help us are the faith communities. How many different churches are within our community? and how could they maybe be of assistance, um, and what messages could they help us push out there, um, because we know a lot of people in our community attend different faith-based initiatives and establishments. So how do we take a look at that and use them as a resource to help us? And so when we look at all of these things here, it's understanding that they're all resources. Because the other thing that we don't want to do is we do not want to duplicate services. If there's a group or two, no more than two, that are already doing it, or if there's three or four or five, excuse me, then why do we need to do that? Or why do we need to fill that void or that gap? If they're already there, that's great. Let's recognize that they're there, and then let's partner with them. Talking about going back to the slide where we talked about maintaining coalitions, and creating partnerships. If there's groups out there that are already doing some of the things that we might need some assistance with, let's partner with them. Let's see how we can come together and deal with the issue that we're trying to deal with. So we want to take a look at the resources also in our community to help us deal with the issue at hand. So after all of that, gathering all that data, we want to analyze the problem. We need to analyze the problem. Analyze the problem. So what does that mean? Well, we want to make a statement uh, for us to look at as a group. And the way we frame that statement or question is, the problem is what? The problem is youth using marijuana at school. I'm not saying that's true. I'm just using that as an example. The problem is cocaine being sold in the parks, where youth hang out and are trying to do something positive. So, what's the problem? So, what we do is we identify one issue or problem at a time. So, we take a look at one problem or issue at a time. We don't want to group or lump them all together, um, because we want to tease out each one. And what I mean by one is, what substance are we dealing with here, or what particular issue, one of them at a time. It might be, the problem is marijuana, the problem is alcohol, the problem is cocaine, the problem is methamphetamines. And after you guys have looked at some of the data from the AYS, you'll be able to see what some of those are. And later on, I'll tell you in some of the other um, presentations that we'll do what we have come up with. But I also want you to take an opportunity to look at the data for yourselves to see if we're in line with one another when we look at that data. But we want to identify one issue or problem at a time regarding substances. And that'll help us determine how to deal with that particular issue. If we lump them all together, it can get kind of convoluted and challenging. And so we don't want to do that. So the other thing that we don't want to do is we want to avoid blame. We want to avoid blame. What that means is we don't want to blame any one or anything in particular. We don't want to blame it because all youth are lazy. That's that's not going to help us, really deal with the issue. That it's all the youth's fault. It's all parents' fault. It's all the church's fault because they never come out and assist us or whatever. We just want to avoid blame. We want to stay to the facts and deal with the issue that's really at hand. We don't want to, in this part of the game, when we're looking at this, if you will, and looking at our assessment and trying to come up with solutions, we don't want to name specific solutions at this point in time. Right now, what we're looking at is just the problem, and we want to dig a little bit deeper into why there is a problem. And so we want to avoid naming specific solutions right off the bat because we have something else that we want to use. I'm going to share with you right now, where we dig a little bit deeper to actually find out what the issue actually is. And so the other thing that we want to do, we want to define the problem by the behaviors and conditions that affect it. We want to define the problem by the behaviors and the conditions that affect it. And so we want to be careful in just coming up with just what we think uh, the problem is, but not looking at it from a behavior standpoint or a condition. A condition that may affect marijuana sales is that the um, there's too many licenses that are given out for our specific area. So that's why there's so many. Um, that's why there's so many outlets, marijuana dispensaries, because there's just too many licenses that are allowed to be given in that particular area. So, um, yeah, you want to you want to define the problem by the behaviors or the conditions, and the conditions, excuse me, that affect it. So the other thing that we want to do is we want to be specific, make sure that we're specific enough so that we can measure things. We want to be able to, you know, make things measurable so that we can show an impact, or that we're actually moving the needle, if you will. That's a term that I learned many years ago. We're moving the needle. So we want to make sure that is it 10% of youth um, are using, or is it 50%? So because we know then if it's 50%, then we want to get it down to 40%. If we're just going to say that we're going to decrease youth use, okay, that's great, but what's the number? How do we know that we're having an impact? If we know that there's 100 liquor establishments, if you will, or places that sell liquor or alcohol, there's 100 of them. Is that too many for our area? So maybe we only want 75, because all of those are, I mean, there are too many that are too close to schools or churches or things of that nature. So we want to reduce that number. Or we may say that there's 100 right now, but we don't want to increase that number anymore. We don't want 101. We don't want 102 or 110. So we are going to make sure that we stay at the 100 mark. So we want to make sure that when we're talking about the problem, that it's specific enough to be measurable. So when we're looking here and analyzing the problem, we want to ask the question, once we establish that the problem is whatever it is, you then want to ask why. But why is that the problem? But why is that the problem? And here's a little chart that helps you. So the problem is that there is, marijuana being sold illegally to youth. But why? And you want to ask that question a few times. So that's why when you look at the diagram that you have, or the figure, you can see that in the middle you put the problem is, whatever the problem is, and then you ask that question about 3 or 4 or 5 times. But why? But why? But why? And then you come up with the reasons of why that problem is. And that helps kind of break it out and or break it down where it's a little bit more digestible, because a lot of times there's more than one reason that there is that problem. And we need to dissect it, and we need to take a look at that. So then once we do that, because again, we're analyzing the problem, you want to ask the question, but why here? Why here? Why is that occurring here? So we know the but why, but then why here? And so when you look at this figure here, you can see they're using the example. Let's go ahead and break this down a little bit. In the middle, where the red circle is, it says that too many young adults are using methamphetamine drugs. Too many young adults are using methamphetamine drugs. So the question is, but why? Well, one of them might be on the left-hand side there, meth, the upper left. Meth is easy to make. Okay. It's kind of true. There is a high demand um, for meth in the lower left. There's a high demand for meth. And then you have the other one to the right of that. Meth is not perceived to be harmful. And so my question to you is, where do we get that from? See, that one right there, we may have gotten from the AYS data that people believe that meth is not harmful. So we can put that into the but why because we looked at some of our data, right, that we gathered um, and can use that to help us not only identify the problem, but actually answer the but why? Why is this a problem? Well, with the too many young people, adults are using methamphetamine, it's because meth is not perceived to be harmful. And again, this is an example. This might be somebody's community out in the within the nation, but again, this is an example. This is not LP can't see. This is just an example. And then the other one is like, but why? Meth is easy to get. Meth is easy to get. So those are the four but whys. So then you take from the but why and you ask the question of the but why here? So meth is easy to get, but why is it easy to get here in our community at that location? Um, and then you, as you can see right there, an example, right, in the rectangle, there are identified dealers. So it's easy to get because there are identified dealers. Okay, all right. So then you look at so meth is easy to get. You just keep asking the question, but why here now? But why here? Before we asking the question, but why? Right? And we did that a few times. Now here we're saying off of each but why bubble, we can ask a few times, 2 or 3 or 4 times, but why here? So the other one is meth sales occur in public areas with little fear of arrest. So that's why it's easy to get, because meth sales occur in public areas with little fear of arrest. So now you can see how we begin to find out not only, so we've identified the problem, but we're beginning to understand why it's occurring and then why here in our community. And that's what makes it unique, right? If somebody were to do this same exercise with this same example, in LP can't see, but then also were to do it in Montana, they may have different results or different answers because their community is different. Every community is different. Just like for us, if we were to look at, answering these questions on the east side of town, it'd be totally different. And the reason that is because, right, when we looked at the data that we had from a demographic standpoint, it's a different makeup. And so the way that they do things there may be totally different than the way things are done down here and handled within our LPKNC area, right? It would probably totally look different in Green Valley. And why would it look different in Green Valley? It would look different in Green Valley because it's predominantly more senior citizens, right? So if they were having a meth issue, that could be the problem. Or part of the problem in them finding the solution is that they're have elderly. So this is how we analyze problems and begin to be moving towards how we want to deal with it and solve it by using this particular model, the but why and but why here. So in conclusion, so let's review. That was a lot, huh? Woo! Well, give yourself a little pat on the back. You made it through. Let's go ahead and take a moment to review all that we've learned so far. So, we first started out with why do we do community assessment? Why do we do a community assessment? A community assessment is important for us all to be on the same page so we know what we're looking at and what we're dealing with within our community. It's really important that we take the time to look at the different data and things that are out there so that we understand where we're going or what we're trying to figure out. Then we said we need to create and maintain coalitions and partnerships. And we said the reason that this was important is because we can get more work done and cover more area with more people than just one or two people trying to tackle this issue on their own. So it's important for us to create and maintain coalitions, and our partnerships are so key. One of the things that we did say also within that is that as far as our partnership are concerned, that youth are so key in helping us to deal with this issue. And so I wanted to stress that with you all before I moved on to this next point. Assess community ATOD needs and resources. So we need to assess the community needs and resources. We need to take a look at what are the things that are actually going on in the community. We wanted to find out what some of the resources are. We wanted to find out some of the gaps. We wanted to take a look at using demographic data and things of that nature. Then also we said we had to analyze the problems and our goals. What that means is that we wanted to analyze the problem and really dig a little bit deeper into our data to find out what the actual problem truly is. And so that meant like looking at the AYS data, looking at our trends as far as alcohol, marijuana, tobacco, meth, cocaine, prescription drugs, and things of that nature. And then we wanted to talk about, okay, then how do we identify that? And we began to do that by utilizing, I believe it was the but why, correct? And by doing that, we were looking at beginning to put ourselves into a situation where we could then develop a framework or model of change. So when we're looking at the analyzed problems and goals, we were saying, okay, what's our problem statement? The problem is, right? The problem is, and then from there we could say, but why? But why is that going on? And then we took it one step further and said, but why here? And so that began to move us into developing a framework or model of change, which we'll be working on a little bit later because it pops up in the 7 steps a little bit later. So the other thing that I want to thank you all for is participating in this slide deck, if you will, and listening to me. And I hope that you learned a lot. I hope that you were able to apply some of the things in the exercises that you did during some of those times when we stopped to see really where we are in our community and where we're headed and what it is that we're actually dealing with. And so it's important to understand that there are 7 steps to this framework. And the next thing that we're going to be looking at is capacity. And we want to talk about building membership, structure, and leadership, because that's key, right? We got to make sure that we have a solid foundation in order to move this coalition along. And you, if you're listening to this right now, means that you are one of those key members that can help us move this along and be great within our community to help our youth be the best that they can be and our community to flourish and shine. So I'd like to thank you for joining me. I'm Jamal Givens. I am with LPKNC, Technical Assistant, and just love that you took the opportunity to listen to this. And so go ahead and put your pens down, turn off your laptops, go ahead and stop playing solitaire or any other type of game, Candy Crush, because the PowerPoint is over. But hey, I'd like to thank you very much. Thank you for being a part of LPKNC, and we'll get at you. Last one that we want to take a look at is perception of parental disapproval of use. So do you believe, do parents believe that their kids should not use or their youth should not use alcohol or marijuana or prescription drugs? Because we do know that parents have are extremely influential on young people because they're the heads of their household. So if parents believe that their youth should not be using alcohol, they are going to make sure that they're translating that message to their youth, possibly. And even if they do disagree with it, if they do disagree with it and they are not passing that message on, then how do we help them pass that message on? What information can we give them? And so there's a lot of different things there that we could do to assist them um, in knowing what they believe or don't